Hello everyone and welcome once again to another short case in managing different cases, different diseases in pregnancy. So today we will be talking about vaginal discharges management in pregnancy. So please, these lectures are only for educational purposes. If you face any of the problem, please seek medical advice from your healthcare professionals. So let us start the case. So as I told you, these all lectures will be short to the point, making you confident that how to treat certain cases in pregnancy. So let us see. The normal vaginal discharge is white. It will be thin, and nothing will be here. And the pH, normal pH, is 3.8 to 4.2. So it's a normal presentation of vaginal discharge. But if let's suppose the lady is been patient is being affected by the trichomonas, how would you know? From the color, if it is greenish yellow, consistency will be thin and frothy, Fifth test will be negative, and the pruritus will be a lot of pruritus. And the diagnosis is based on wet mount microscopy, and you see they are motile, and the pH will be 4.5. So this will be the typical presentation of trichomonas. And how would you treat this patient? You would treat this patient by giving metronidazole 2 gram single dose or 200 mg TID for 7 days. And remember please that you need to treat the sexual partner too. You don't just need to treat that patient. You need to treat with which the patient had sexual contact. So next we have the candidiasis. The color will be curdy white, consistency will be thick, Swift test will be negative, there will be pruritus, but differentials on the diagnosis will be on the wet mount microscopy, which shows hyphae and spores. And it will be, the pH will be normal. So how will you treat? Fluconazole 150 mg orally weekly for 6 weeks. Once a week you need to give the patient 150 mg fluconazole. This is a typical presentation for candidiasis. Next, we have bacterial vaginosis. Color will be gray, white to yellow. It will be thin, positive. This thing will differentiate between the different characteristics of vaginal discharges. So whiff test will be positive, and it will be fishy amine, fishy odor. And there will be no pruritus, as you can see here is two pruritus, but here is no pruritus. And on diagnosis will be microscopy will shows clue cells, and pH will be raised. This is the pH will be raised here, and the pH will be raised in trichomonas. How will you treat? For 7 days, same metronidazole. Then we have chlamydia infection. So how would you treat chlamydia, and how is the presentation? Color will be mucopurulent, consistency will be thick, and whiff test pruritus will be negative. Chlamydia is diagnosed by doing the NAT test. The pH will be low. So remember, here the pH was raised, but here the pH is been low. And how would you treat? Azithromycin 1 gram orally single dose is enough for the management of chlamydia or vaginal discharge. So let us go toward the different presentations and how they have been managed, selection of drugs in the pregnancy. So for trichomonas, in pregnant lady, you need to use metronidazole or clindamycin for 7 days, but after the first trimester. Please follow the new guidelines. If you saw new guidelines, please share it in the comment section. The candidiasis, recommended treatment for vaginal candidiasis is topical antifungal, such as clotrimazole or miconazole. And for symptomatic vaginal candidiasis, you need to give dosage of 500 mg clotrimazole for 7 days. So clotrimazole can be safely used. And if the patient has been infected by bacterial vaginosis in pregnancy, So you can treat her by prescribing 250 mg of metronidazole 3 times daily for 7 days, or clindamycin 300 mg twice daily is recommended. So remember, you need to follow the new guidelines for the management, because if she's pregnant, you need to know which medications are safer for the pregnant lady and for the baby. I hope you have learned something new, and hope to see you in future lectures. Please like and subscribe my channel. Thank you for your